Hi, my name is Cami Corvino. I am doing the head, face, neck, and eye assessment on my patient.
My name is Bill Corvino and I consent to this video.
Okay, so first I'm going to look at his head. I'm going to inspect his head. It looks symmetrical. I'm going to palpate it and feel for any bumps or abnormalities, and it feels normal. I'm going to look at his face now. His face is symmetrical. There's a slight deviation to the right of his nose. His chin and jawbone and everything are symmetrical. Okay, I am just going to feel his skin. His skin is nice and warm. It is not dry. I'm going to just press on his face to check his sinuses. Do you feel any pain or pressure when I do that?
No.
Okay. Now I am going to inspect his neck. I'm going to check the lymph nodes first. First I'm going to palpate. I'm going to palpate the preauricular, postauricular, tonsillar, submental, anterior cervical, and posterior cervical. Oh, I'm sorry, I forgot the occipital. And the posterior occipital. Posterior cervical. And also the supraclavicular. And I don't feel any abnormalities in any of his lymph nodes. Nothing is enlarged. I'm looking at his neck. His neck is straight. I'm just going to check his movement. So, Bill, can you please look to both sides so I can check the mobility of your neck? Yep, to your right and to your left. Okay, can you look down and put your chin to your chest? Okay, put your head back up. And please put your head back. Okay, and just bring it back to center. I'm going to palpate his trachea, and I'm pushing it to one side. It moves easily, no problems. His neck is symmetrical. There's no bumps or anything that I can see. I'm just going to move around to the back to inspect his thyroid. So, Bill, can you swallow, please? And one more time. Okay. I do feel a small nodule on the left. Okay. So now I'm going to look at his eyes. I'm looking at his eyebrows and his eyelashes. Excuse me. Everything, his hair distribution is nice and uniform. There's no crusting or anything. There's no tearing noted in his eyes. Let me see your eyes. They're brown. Very nice. I'm just going to pull down on your lids, and they're nice and pink. I'm just going to press on your lacrimal glands, and there's no tearing or anything noted. Okay, so now I am going to check your visual field. So if you just look straight at me and just tell me when you start seeing my fingers.
No.
Okay?
No.
Okay. Okay. And I am going to I want you to look at my finger and just watch my finger and keep your head still and just track where my finger goes. Okay, all of his ocular movements are smooth. I don't see any nystagmus occurring. I'm just going to check his pupillary response with a light. Okay, his pupil constricts on both sides when I bring the light over to the side. Just look at the light for a second. Okay, and his pupils constrict. And I'm going to check for accommodation. So can you look at something in the distance for me? Okay, now I want you to look at my finger. And there is a pupillary response when he looks at my finger, and his pupils constrict when I check that. I also wanted to check for TMJ. Let me just check your temporomandibular joint, and can you just open your mouth for me and close, and open it and close it. I don't feel any clicking, any crepitus. It's a nice smooth movement. And that concludes our exam. Thank you.